I'm standing here under the canopy in front of the beautiful IRL building. This is where the patients will get dropped off, and as they get dropped off, it's very close that they will walk through to come to the front door to enter the building. However, if the patient decide to park in the parking ramp,
they would come out of the main parking ramp entrance and walk along underneath the cover about 20 feet roughly to the building, not very far at all, either from the drop-off or from the parking ramp, and come to the front entrance of the building, and we'll go in now. So we're coming in the main entrance. When patients step in the main entrance, they're going to be greeted at the front desk, as well as have the message boards available as well to let them know who is in the building and what's going on that day.
And as we enter, you can look to the right side and you will be able to see our pharmacy. It is a full ambulatory pharmacy. You will be able to pick prescriptions. It is a friendly environment that has been created to allow an ease of access as well as very efficient workflow. As you look in our pharmacy, you are going to find on the shelves some of the over-counter medication, as well as we'll be stocking some of the commonly used equipment like breastfeeding supplies.
This is the breast imaging area at IRL. We have 3 dressing rooms, an approximate waiting area close by. It's a very private space built for our women patients. In our mammography space, we have a hologic system, state-of-the-art breast imaging system, one of what would eventually in the future be 2 systems here at IRL.
October is Breast Awareness Month, and we'll be able to accommodate walk-ins to help prevent breast cancer. We are standing in CT scan. We are proud of the new machine as well as the layout of this room, which allow a natural light to come in, as well as you can see the nice ceiling tiles that give a different look for this room. It is still a little bit under construction, but hopefully will be finished in the next couple of days.
This is our phlebotomy area at IRL. We have 5 open bays and 1 enclosed room for blood draws. We also have a pneumatic tube station that will be utilized by the staff to get the specimens and the draws down to our laboratory, which is in the lower level. The tube systems throughout the building for use by pharmacy and staff on all floors for that purpose.
A couple of things we wanted to highlight about the lab. One is that we are going to be open early. Lab is going to open at 7:15 to be able to do fasting blood draws. We also, all the phlebotomy staff are able to do both adult, ped, and baby draws. So we can service the entire spectrum of the population here. So I'm coming up the stairs from first to second floor. Second floor is green. The theme is butterflies. This is a public stairwell, so the public can use either the elevator or the stairs to come up to second floor. Here on second floor, we have the eye department. We have otolaryngology, ENT, and we also have pediatrics.
Here in pediatrics, and I want to highlight some of the equipment in this facility. This is a scale that it is designed to accommodate wheelchair patients. We have one of those on every floor to allow us to accommodate for any kind of patients that visit our facility.
Here we have a wall up separating 2 areas in our pediatric waiting area. It's actually an interactive wall where the children can look at the letters, try to make words, as well as having alcoves where we can place books.
We are on 3rd floor. The symbol is wheat grass and the orange color. And this floor will house women's health, OBGYN, dermatology, urology, and cardiology.
So we're entering the patient area on 3rd floor, cardiology. Here in cardiology, we are able to address a majority of patient cardiology needs. We are able to do checks on pacemakers as well as the vascular lab. We're walking down the patient hallway. On our left-hand side here is the echo stress test area. A little bit further down, we have our general stress testing area as well as our exam rooms that are here on this side. As we get further down the hallway, we have a nuclear testing area for nuclear exams. And then in the back corner of the area, we also have the ability to do EKG exams.
We are standing in the work team area, and you can see that there are dashboards. as well as computers for all providers, as well as support staff to be able to access information. We are exactly 3-4 feet away from the exam rooms that we will be able to enter and interact with our patients. This area is designed for allowing collaboration and help with communication among the providers and the rest of their team members.
So I'm sitting on a bench here in one of our pediatric rooms. We have benches in all of our exam rooms here at IRL. They are built for individuals to be able to use with their family members, and they're also rated capacity-wise to be able to handle our bariatric population that will be visiting us here at IRL as well.
We're on the 4th floor, so magenta is our color and echinacea is the pattern. You'll see that highlighted in the stairwell on each floor, both our visitor and our staff stairwells, as well as our signage and our wayfinding signage. So we highlight that so people will know what floor they're on at all times.
On the 4th floor, we have diabetes, general internal medicine, as well as GI here.
I'm standing inside the exam room, and as you can see, our exam room is built with on-stage, off-stage patterns. So the patient will come from this side, the providers will come from the other side. Most of our exam rooms were built with the intent to do most of the work within the exam room. So you will be finding some of the equipment from otoscope to pulse ox to blood pressure and temperature. Also in the exam rooms, we'll have a signature pads that we will be able to obtain authorization for immunization and other procedures. We have printers inside the room, so we will be able to not only do a prescribing, but if we decided to print a prescription, we'll be able to do it within the exam room and finalize the work for our patients.